If you have ever had a PSA test and your doctor said everything looks fine and just moved on, this video is for you. Because one PSA number checked once without context and without a follow-up plan is not really early detection. It is just a checkbox. And for a disease that affects about 1 in 8 men, over a lifetime, a checkbox is not enough. I'm Dr. Jeffrey Shookman. I'm board-certified physician in internal medicine and obesity medicine and the founder of White Olive here in Woodland Hills, California. I have this conversation with patients all the time. Men who have had a PSA testing for years, but no one has ever really explained what the numbers mean, why it changes and what changes matter, and what should happen next. So today I want to walk you through that specifically. I'm going to explain what PSA actually is, why one reading is almost never the full story, and what a more thoughtful approach to screening looks like. And I also want to cover one issue that is especially important if you take finasteride for hair loss, because that can change how PSA should be interpreted, and many men are never told that. Let's get into it. PSA stands for prostate-specific antigen. It is a protein made by the prostate. Some of it enters the bloodstream, and that is what we measure on a blood test. Here's the part that is often misunderstood though. PSA is not a cancer test, it is a prostate signal. And like most signals in medicine, it only means something when you interpret it in context. PSA can vary with age, it can vary with prostate size, it can vary with inflammation, recent ejaculation, and even normal day-to-day fluctuations. So when someone looks at one PSA isolated result and simply says normal or abnormal, that often misses the big picture. Because what matters is not just the number itself, what matters is what that number means for that particular person over time. This brings me to one of the most important concepts, PSA velocity. PSA velocity means how quickly the PSA is changing over time. And in many cases, the trend is more informative than the individual number. Here's an example. A man has a PSA of 1.3. No one is concerned. And years later, it is 1.7. Still considered normal by many standard blood tests. 6 months after that, it is 1.9. Now I am paying attention because even though each number by itself may not look alarming, the pattern is telling me something. The signal is not just the value. The signal is the direction and the rate of change. This is where careful medicine matters. Not just checking the box that a PSA was ordered, but actually plotting the data and asking whether the story is changing. We see this in practice. Men who have had a PSA value in their chart for years, but no one ever stepped back and looked at the trend or the velocity. And sometimes the trend was the most important part. There's another concept that many men have never heard about. PSA density. As men get older, the prostate often gets larger. And when the prostate gets larger, PSA can rise for that reason alone. That can be very normal. PSA density helps us interpret that more accurately though. It looks at the PSA level relative to the size of the prostate. That matters because a PSA of one value can mean very different things depending on whether the prostate is small or enlarged. This is one reason prostate MRI can be so useful in the right setting. It can help us understand prostate volume, look more closely for suspicious areas, and decide whether further evaluation is actually needed. Sometimes MRI helps avoid unnecessary biopsies. Sometimes it helps identify who really does need the next step. Either way, it gives us better information. Now, I want to talk about something that I think far more men should know about. If you take finasteride or dutasteride for hair loss, your PSA may look lower than it truly is. Finasteride lowers DHT, which is one of the hormones involved in both hair loss and PSA production. So when DHT is suppressed, PSA is suppressed too. That means the lab value on the page may not reflect the full signal. In many cases, PSA in men taking finasteride needs to be interpreted differently than PSA in men who are not taking it. And that matters because if neither the patient nor the physician is accounting for that, there is a risk of false reassurance. A number may look comfortable when in reality it deserves a closer look. That is a very different clinical picture. So if you take finasteride, make sure your doctor knows. Do not assume it is obvious or that it is already being considered. It is worth bringing it up directly with your doctor because context changes, interpretation changes what happens next. What thoughtful PSA screening looks like. So let me bring this together. PSA can be a useful tool, but it only becomes a strong screening tool when it is used carefully. That means looking at the trend over time. That means understanding PSA velocity. That means considering prostate size and sometimes PSA density. And that means knowing whether medications like finasteride are affecting the reading. One PSA number is a data point. Your PSA over time interpreted in context is a story. And that story is what helps us determine problems early and we can make better decisions. If you want to stay informed on this topic or topics like this, sign up for White Olive's newsletter and we will go ahead and send one thoughtful issue each month based on what we are seeing in practice and what the evidence actually supports. And if you are ready to have a more personalized conversation about your own health, we offer a 15-minute free consultation to see if our clinic is right for you. If this video was helpful, share it with men in your life. This is the kind of information more people should hear before their next physical. I am Dr. Jeffrey Shookman. Thanks for watching.